In 2011, Idaho was selected to participate in Work Support Strategies, or WSS, a foundation-funded initiative that helps states streamline their work support programs for low-income families. With funding and technical assistance through WSS, Idaho designed, tested, and implemented innovative strategies to integrate and streamline delivery of Medicaid, the Supplemental Nutrition Assistance Program, or SNAP, and child care assistance.
Work support programs are the programs that families depend on when they're entering the workforce and need help with some of the very basic supports of keeping them stable. And we really believe that having those three programs tied together helps maintain that stability and helping families to stay in the workforce. The vision for Idaho when we first entered into this project was to try to find ways that we could have integration across our programs so that when families were coming in and looking for help and they were trying to find a path to self-sufficiency, that they were able to find a seamless way to provide for their family while maybe they were making minimum wage or lower wages.
The Work Support Strategies grant really helped Idaho expand our horizons, and I think what it really did was help us experience and participate in a much larger learning community. So the opportunities for sharing and learning and testing ideas was amazing.
We have stayed very tied to our vision of integrating the programs that are truly intended to help families. And that was really difficult to do with as policies changed significantly between SNAP and Medicaid. We stayed very closely tied to those programs. We tried to make sure that as much as possible our policies and our processes aligned, and that when families came in asking for help or were seeking help, that we were able to offer them options across all programs, that they didn't have to go to another agency, that they didn't have to fill out a different application. But when the family came in, we were able to talk to them about what their situation was and offer them access, immediate access, into all three of those critical programs.
Using electronic data matches, Idaho has implemented no-touch eligibility renewals for many Medicaid customers, easing the burden on families and staff.
My biggest lesson learned, I think, for Idaho, and even for me as we've gone through this project over the last 4 years, is the landscape is constantly changing around you. And you have to stay true to what's important for families and what you're trying to solve for the family.
I would say they need to really focus on what a family needs and understand what a family goes through when they apply for services or try to access services, really to see those services through the eyes of the family. I think sometimes we get carried away with the processes and the rules and the regulations, and we lose sight of what it really takes to help a family get access to the services that we offer.